Good morning, everyone. Today, we're going to talk about a very common, yet often overlooked, issue for those managing high blood pressure, stomach aches, and their connection to hypertension medications. For our elderly population, understanding this relationship is even more critical due to unique age-related changes. Our goal today is to shed light on why this happens, what else could be causing stomach pain, and most importantly, how we can all work together to manage these challenges effectively. We often hear hypertension called the silent killer because it typically doesn't announce its presence with clear symptoms. This makes the daily regimen of blood pressure medications absolutely crucial. These drugs are lifesavers, preventing strokes, heart attacks, and kidney disease. But, like many medications, they aren't without their downsides. One of the most common complaints is a stomach ache. For older adults, this issue is even more complex due to age-related changes in the body and increased vulnerability. We'll explore this further today. Let's get straight to the point. Can hypertension medications cause stomach ache? The answer is a resounding yes, and it's a very common issue. It's often misunderstood that high blood pressure itself directly causes stomach pain in its usual, chronic state. But the medications we rely on to manage hypertension very frequently list gastrointestinal upset as a potential side effect. The key takeaway remains: always discuss any new or worsening stomach pain with your doctor or pharmacist. Beyond just the direct medication side effects, there are a couple of other important considerations when we talk about stomach ache and hypertension. Firstly, the stress and anxiety that can come with managing a chronic condition like high blood pressure can absolutely manifest as real stomach discomfort, thanks to the powerful mind-gut connection. Secondly, and this is crucial, in very rare and severe situations, an extremely high blood pressure event, a hypertensive crisis or emergency, can cause stomach pain as a direct symptom of acute organ damage, like issues with blood flow to the intestines or an aortic dissection. This would be a medical emergency needing immediate attention. Let's start looking at how different classes of blood pressure medications can affect your stomach. ACE inhibitors, like lisinopril, can cause general stomach upset, nausea, and diarrhea. A very rare but extremely serious side effect with ACE inhibitors is something called intestinal angioedema, which causes intense abdominal pain and requires immediate medical attention. Then we have angiotensin receptor blockers, or ARBs, like losartan. While generally well tolerated, ARBs can also result in stomach pain, diarrhea, or indigestion for some individuals. Continuing with other classes, calcium channel blockers, like amlodipine, are particularly known for causing constipation, which can be quite uncomfortable, along with nausea and heartburn. Diuretics, often called water pills, can cause various GI symptoms including stomach cramps, nausea, vomiting, and changes in bowel habits like diarrhea or constipation, and they might even reduce your appetite. Finally, beta blockers, such as metoprolol, can also lead to general upset stomach, nausea, diarrhea, or constipation. It's crucial to remember that not everyone experiences these side effects, and their severity can vary. Often, these issues are more noticeable when you first start a medication or increase a dose and may lessen as your body adjusts. Sometimes, simply taking your medication with food can make a big difference. While medications are a common cause, it's vital to remember that stomach ache is a very general symptom with a huge range of underlying causes. For someone managing hypertension, it's crucial to differentiate a medication-induced ache from something else entirely. Many common stomach aches are mild, caused by things like indigestion, gas, constipation, a stomach bug, or food intolerances. Even stress and anxiety, as we've discussed, can manifest as abdominal discomfort. Then there are more specific inflammatory conditions like appendicitis, which is an urgent concern, or diverticulitis, and various forms of gastritis or ulcers. Beyond the more common issues, Stomach ache can also be a sign of problems with specific organs, such as kidney stones or infections, or issues with your liver or spleen. For individuals with ovaries or a uterus, gynecological or urological conditions like severe menstrual cramps, ovarian cysts, UTIs, or even a medical emergency like an ectopic pregnancy can cause abdominal pain. And then there are other serious, less common causes like a bowel obstruction, a trapped hernia, or a ruptured abdominal aortic aneurysm, which is a life-threatening emergency. Given this extensive list of potential causes, it's crucial to know when a stomach ache requires immediate medical attention. Look out for these red flag symptoms: any stomach ache that is severe, persistent, or rapidly worsening. This is especially true if it's accompanied by a fever, persistent vomiting, blood in your stool, whether it looks black and tarry or bright red, or if there are any changes in consciousness or confusion. And as we discussed, if your blood pressure is extremely high, as in a hypertensive crisis, and you have severe abdominal pain, that also warrants immediate medical attention. If you experience any of these, do not wait, seek immediate medical attention. So, how can you tell if your medication is the cause? Look for patterns. Consider the timing. Did the stomach ache begin shortly after you started a new medication or increased a dose? Does it consistently occur after you take your medication? Think about the medication type. Is it known for GI side effects? Also, are you taking any over-the-counter drugs, like NSAIDs such as ibuprofen, which are notorious for stomach irritation? What other symptoms are accompanying the stomach ache: nausea, vomiting, diarrhea, or constipation? And always review the patient information leaflet that comes with your prescription. Most importantly, if you suspect your medication is causing stomach ache, never stop taking it without talking to your doctor first. Suddenly stopping blood pressure medication can lead to dangerous spikes in blood pressure. Contact your healthcare provider. They might suggest taking it with food, adjusting the dose, or trying an alternative. When an elderly person experiences a stomach ache, it demands heightened attention. Their bodies handle illness and medication differently. Symptoms might not present typically. For example, a heart attack could manifest as indigestion, or a severe infection just as general lethargy. They might also have blunted pain responses, leading to delayed diagnosis. They are also more vulnerable due to weaker immune systems, multiple existing health conditions, and reduced physiological reserve. A relatively minor stomach issue can quickly lead to dehydration or electrolyte imbalances. A major concern is polypharmacy, taking numerous medications, which significantly increases the risk of drug interactions and cumulative side effects. Age-related declines in organ function can also lead to drug accumulation. This is where deprescribing, the systematic review and reduction of medications that may be causing harm or are no longer beneficial, becomes incredibly important. Finally, illness or medication side effects can trigger geriatric syndromes like falls, delirium, or frailty. For all these reasons, any stomach ache in an elderly patient, particularly if severe, persistent, or accompanied by red flag symptoms, should prompt a prompt medical evaluation. If your current hypertension medications are causing stomach ache, your doctor will thoughtfully consider alternatives. This often involves a discussion about whether to switch to a different medication within the same class or to an entirely new class. Switching within the same class, for example, from one calcium channel blocker to another, is based on the idea that subtle differences between drugs in the same group might reduce your specific side effect while maintaining the proven blood pressure lowering mechanism. The pros are predictable efficacy, but the con is that the stomach ache might persist if it's a true class effect. Switching to a different class offers a completely different mechanism of action, providing the best chance to eliminate a class-specific side effect. The pros are a high likelihood of resolving the issue, but the cons include introducing a new set of potential side effects and requiring careful monitoring during the transition. Recognizing that frequent doctor visits can be challenging, especially for elderly individuals, here are practical steps you can take to manage medication concerns and GI side effects. First and foremost, leverage your pharmacist. They are highly accessible medication experts right in your community. They can perform a comprehensive review of your entire medication list, that's prescriptions, over-the-counter drugs, and even supplements, to check for potential interactions or duplications that could cause GI upset. They can provide detailed counseling on expected side effects and how to mitigate them, suggest appropriate over-the-counter remedies for mild symptoms like indigestion, and even contact your doctor directly if they identify a significant concern or a need for a medication change. They can also help with medication synchronization to simplify your daily regimen. Another vital step is to keep a detailed symptom diary. Before you can even speak to a healthcare professional, meticulously record when you take each medication, when the stomach ache starts and how long it lasts, the nature and severity of the pain, any other accompanying symptoms like nausea or constipation, and what makes the pain better or worse. This detailed record provides crucial information, making your limited time with a doctor or pharmacist much more productive. Secondly, make proactive lifestyle adjustments for GI comfort. Many common GI side effects can be eased with simple adjustments. For nausea or upset stomach, eat smaller, more frequent meals, and avoid very fatty, spicy, or acidic foods. For constipation, gradually increase fiber intake and ensure adequate hydration. For diarrhea, focus on bland, easy-to-digest foods like the brat diet. Generally, avoid lying down immediately after meals and limit caffeine and alcohol if they worsen symptoms. And always discuss with your pharmacist or doctor if a medication consistently causes upset on an empty stomach, as it might be okay to take it with food. Finally, 2 more crucial practical steps. First, prioritize medication adherence. Unpleasant side effects like stomach ache are a leading cause of patients stopping their medications without medical advice. This non-adherence is a serious risk for hypertension, as uncontrolled blood pressure can lead to dangerous complications like strokes, heart attacks, and kidney failure. Promptly addressing side effects, even with a pharmacist initially, is vital to ensure continuous, safe, and effective treatment. And second, be prepared for your doctor's visits. Even if visits are infrequent, make the most of them. Bring your symptom log, all your medications or an updated list, and a clear list of questions or concerns. This efficient use of time helps your doctor make the best decisions for your health. In conclusion, managing hypertension, especially in our golden years, is a journey that often involves navigating the complexities of medication side effects. While a stomach ache can be concerning, understanding its potential links to blood pressure medications is the crucial first step toward effective management. For elderly individuals, this understanding is even more critical because symptoms can be deceptive, and side effects more pronounced. This underscores why a seemingly minor complaint like a stomach ache should never be dismissed without proper medical evaluation. Ultimately, effective hypertension management, and indeed, overall health for elderly individuals, hinges on a collaborative partnership. This involves the patient themselves, their caregivers, their pharmacist, and their prescribing healthcare team. Openly communicating symptoms, diligently tracking medication effects, and engaging in informed discussions about treatment options are vital to achieve optimal blood pressure control with the fewest possible adverse effects, ensuring a better quality of life and sustained well-being. Thank you.